Now, two diseases form part of the major public health challenge in Africa.
They are malaria and hypertension. For malaria, it is a preventable disease that costs less than $1 to treat. But sadly, according to the World Health Organization's 2019 World Malaria Report, no significant gains were made in reducing malaria cases between 2015 to 2017.
The report revealed that Nigeria contributes 27% of the 216 million malaria cases and 24% of the 444,000 malaria deaths globally.
According to WHO's Global Status Report on Non-Communicable Diseases 2010, Africa has the highest prevalence of hypertension, estimated at 46% of adults aged 25 years and above. Hypertension, also known as high blood pressure, is a medical condition in which the force of blood against the artery walls is too high. It is the most important risk factor for cardiovascular disease, and in Nigeria, research shows that 1 in 3 adults is hypertensive. Joining me in the studio is Sabu George, a medical doctor and member of the Board of Directors Medical Aid for Africa. Thank you for joining us on TVC Breakfast.
Pleasure.
Now, before we go to the interventions by your organization, let's start with understanding the symptoms, because some persons you hear just drop dead, and certain persons perhaps just go to the hospital and are told, you know what, your blood pressure is high. And we don't even have the culture of just walking into hospitals to check our blood pressure. What are the symptoms to take note of?
So unfortunately, hypertension is a silent killer. So there are no typical symptoms. Some people, the rarity, may have early morning headaches. Some people may get nosebleeds when the blood pressure gets very high.
Wow.
But unfortunately, most people know they have high blood pressure only when they get their blood pressure checked. But it's very easily treated. So if you just go to any of the local health centers, or my understanding is actually many pharmacies offer routine blood pressure screenings. You can easily get it checked. It doesn't cost anything.
Now, how has it been creating awareness? Has it been challenging? Because, like I said earlier, we do not have that culture of walking into hospitals to do medical checks, so to speak.
Yeah, so again, I'll go back to what I said earlier, which is the foundation set up by the former First Lady of Oyo State, Mrs. Ajumobi, is something that really should be reproduced across everywhere in Nigeria. They have something called the Access to Basic Care, where they empower nurses to screen anyone who comes in for high blood pressure. They give them a small book. They tell them that, you know, the disease is not like malaria, which is a common misconception, that once you treat it for 30 days with drugs, there's no need to take the medicines anymore. That is a frequent challenge that I've come across. So a lot of what our foundation does is actually just educating the people to create awareness in them that once you start taking the medicines and controlling the blood pressure, the treatment is for the rest of that person's life. It's not for 1 or 2 days or 1 week or 2 weeks. So it's for the rest of the person's life. So Mrs. Ajumobi has actually had a system where they empower the nurses screen, they give the patients a small book, they give them the initial month's supply of drugs. They tell them that you can get 2 drugs in the local pharmacies made in Nigeria, very effective, for 1,500 to 2,000 naira, which is affordable for most people. So it's something that's very commendable.
How about the other drugs? And is there a system in place where these people are monitored to ensure that they keep up with their treatment or taking their drugs?
Sure. So that same program that they have in Ibadan, the patients come back every 2 to 3 months, and they come back, they may not know a word of English, but they can tell you exactly which 2 medicines they're on. And it was really commendable because even in the US, you don't get the degree of adherence to the medicines, the degree of compliance that I saw in Ibadan. It's really commendable. And they follow up with them, they can tell them, you know, continue taking your medicines. They write their blood pressures each time they visit. The patients carry the books with them, the names of the medicines. So it creates awareness in all the populace that I've seen over there.
Now, these books, if they cannot speak a word of English, are they translated in other languages so that people can really understand what is written in them?
So what basically write in them are the names of the drugs, the number of milligrams, and the blood pressure on each visit. So I guess there is some use to translating it to other languages.
All right, we have to leave it at this point. Sabu George, Medical Director, Board of Directors, Medical Aid for Africa. Thank you for your time.
Thanks.
Watching TVC Breakfast. Now, two diseases form part of the major public health challenge in Africa.
They are malaria and hypertension. For malaria, it is a preventable disease that costs less than $1 to treat. Sadly, according to the World Health Organization's 2019 World Malaria Report, no significant gains were made in reducing malaria cases between 2015 and 2017.
The report revealed that Nigeria contributes 27% of the 216 million malaria cases and 24% of the 448,000 malaria deaths globally. Now, according to WHO's Global Status Report on Noncommunicable Diseases 2010, Africa has the highest prevalence of hypertension, estimated at 46% of adults aged 25 years and above. Hypertension, also known as high blood pressure, is a medical condition in which the force of blood against the artery walls is too high. It is the most important risk factor for cardiovascular disease, and in Nigeria, research shows that 1 in 3 adults is hypertensive. And joining me in the studio now is Sabu George, a medical doctor and member of the Board of Directors, Medical Aid for Africa. It's good to have you join me, Dr. George. Now, your organization has been trying to reach out to people, trying to also bring down the number and the prevalence of malaria, hypertension, and all of that. What do you really ultimately, what do you really stand to? What's your projection?
Well, the ultimate goal, the ideal, is to get everybody screened to see whether their blood pressures are high, and to encourage awareness in everyone to have their blood pressures checked, and if they are high, to get treated, and also to understand that the treatment is lifelong. You can control the disease, you can't cure it. There are certain things that you can do that will help it. You may reduce the dosage by losing weight and so on and so forth. But the main thing is to increase the awareness across every segment of the population. That should be the ideal goal.
All right. Approximately how many people have you impacted so far since this project started?
So again, each time me and my brother and the rest of our team come, we see about 600 to 800 patients. But we're here for a few days and then we leave. But again, I can't overemphasize the importance of our last visit to Ibadan and seeing what the former First Lady, Ms. Ajumobi, has done there. That model, if it can be replicated all across Nigeria, that will do a lot, particularly for the poorest of the poor. Give them access, show them how to take the medicines, what medicines to take, how to keep a track of their blood pressures and so on. You can impact longevity in a big way.
What would it cost the people to get this treatment and screenings and diagnosis and all of that?
Well, to get screened basically doesn't cost anything. If you go to any of the local health centers, I don't know what the cost is for a patient to go there, but I'm sure it's not much, because it's really the poorest of the poor that go there. They check their blood pressures. If they are high, they can tell them what medicines to take. One of the biggest things that you can impact with regards to awareness is how cheap the medicines actually are to the patients, so that know that, okay, this thing does not cost 1,500 naira for 2 drugs for a month, or 2,000 naira for a month. To keep a person alive and well is not a big price to pay.
All right, for your Medical Aid for Africa, what likely challenges do you face on the field as you go about?
Well, it takes a lot of people. To pull off each of these missions, it probably takes about 100 to 200 people.
Wow.
Yeah, either directly or indirectly each time. When we kicked off the mission this time, the wife of the current Lagos State Governor, Dr. Mrs. Sanwo-Olu, kicked it off. That's a very good thing. It's, she tries to reach a lot of people as well. So a lot can be done by just information, dissipation of information to the general public as a whole.
All right. For the year 2019, is there a special project you have to achieve this year?
Well, so we want to now open our website in the U.S. It's been open, but we want to open it to accept donations. We are a non-for-profit, and we're one of the few non-for-profits where 100% of what you donate goes directly to buying medicines and giving them. Every person that comes for these missions has to pay their own way. You know, so we don't use any money for administration.
Talk to us about partnerships. Are you partnering other agencies like you into the project?
So we are, and we partner actually. Our local partners on the ground are the National Sports Lottery Foundation and SET PLC, the two companies together. They're headed by my colleague from med school, Dr. Odlami Koladaisi. And there was also another organization we partnered with this time, which is the, I can't remember the name exactly, but it was a local organization. They provide logistics on the ground, and they reach the segment of the population that convinces them to come for these events.
Dr. Sabu George, thank you so much for coming on the program, and we wish you well in your assignment as well.
Thank you.
Thank you. Right.